Back pain is one of the commonest reasons for a doctor's visit. We all have back pain at least once in a year. That's perfectly fine as long as the pain disappears in a few months. Friends, what if you continue to have pain for months or even years? That's not a good news. One reason for such a long-standing pain is a condition called spinal stenosis. Let's explore spinal stenosis in this video. Hello and welcome. I am Dr. Arun Naik, a doctor for 30 years and a neurosurgeon for 20 years now. Dialogue with your doctor is called a doc log. In this channel, we have doc logs related to brain and heart health, lifestyle diseases, cancer, spine health, and preventive health. If you're new here, we also give simple, effective tips and tricks to put you on the positive side of your health. With that said, let's get started. Your backbone is not a single piece of bone. Had it been that way, I don't think we would be dancers, footballers, bike riders, or swimmers. Luckily, God has given us one of the most flexible backbones among all animals. This flexibility, friends, is a boon and a bane. Bane, especially if you abuse your spine. As you grow older, your spinal bones also get old and there will be changes due to old age, which ultimately leads to extra growth of tissues inside the vertebral column, compressing the spinal cord and nerves. We call this a spinal stenosis. Stenosis is narrowing in medical terms. Spinal stenosis is a condition in which the spinal column gets narrowed and starts compressing the spinal cord. This process is typically gradual. If the narrowing is minimal, no symptoms will occur. Too much narrowing can compress the nerves and cause problems. Spinal stenosis can occur anywhere along the spine. How much spine is affected can vary. What are the causes of spinal canal stenosis? Number one, commonest cause is advancing age. As we age, our bones get grown, our tissues expand, and the end result is compression on our spinal nerves. This is also called spondylitis or spondylosis in medical literature, which encompasses so many diseases seen in the old age. Old age spinal stenosis often begins with mild pain and stiffness of the body, later becomes walking difficulty. Walking causes pain and they have to stop walking and take rest. On resting for a few minutes, their pain disappears and they can move forward till they get pain again, and then they have to rest again. So this walking pain is called claudication pain. This claudication pain is very typical of spinal stenosis and this is progressive. Over the years, their walking distance reduces to few meters. Number two, spine defects present at birth. We call it as congenital spinal defects. Some of the birth defects can cause spinal stenosis in the adulthood. These birth defects are generally diagnosed in the childhood, but I see many defects coming to light in the adulthood. Many of these conditions are severe and require surgical intervention. Number three, cervical canal stenosis. Here, the spondylitis affects the neck bone. Extra tissue grows and compresses the spinal cord. The result is very dramatic. The compression on the spinal cord is very critical. This leads to imbalance while walking with frequent falls. Slowly, they lose power in their limbs and walking becomes difficult. They lose control on their urine and feces. And the last stage in the disease process, unfortunately, is a bedridden state. So this spinal canal stenosis happening in the neck bone is more dangerous than occurring in the backbone. What are the symptoms of spinal stenosis? Well, spinal stenosis is not a sudden occurring disease. It's a chronic illness lasting many months to years. Many patients complain of back pain, neck pain, which goes to their limbs. They also complain of tingling numbness or pins and needle sensation in their arms and legs, especially at night. Later stages, they develop motor symptoms like weakness of the limbs along with walking difficulty. In advanced stages, they end up in bed. How to diagnose spinal canal stenosis? When I see a patient with suspicion of a spinal canal stenosis, I do a detailed neurological examination to determine the issues. My doubt is spinal stenosis, then test of choice is undoubtedly an MRI scan. MRI scan shows exactly where is the compression and how much is the compression. It will also help us to plan the treatment modality. What is the treatment of spinal stenosis? As always, first line of treatment is non-surgical medication treatment. Depending upon the severity, the medications works for long time. If spinal stenosis is severe, then medicines will not work for long, especially if they are bedridden or if the pain is severe. Many surgical options are available to address spinal stenosis. Surgical intervention decompresses the spinal cord and nerves. Once the nerve pressure is relieved, they get better. Coming to post-surgery rehab program. Spinal stenosis patients have a lot of issue with their mobility. Rehab programs will make their mobility better. Their imbalance needs to be addressed too. Walking needs restructuring. This we call gait training. Now, what is the outlook for life? Outlook for life or prognosis depends upon the severity and the time duration of progression. If the spinal canal stenosis is addressed early, then the outlook is good. If the patient is significantly affected in walking and weakness, then unfortunately complete recovery may be difficult and patient will continue to have significant neurological debility in spite of surgical intervention. With that, friends, we have come to the end of this video. I hope you like the content presented. Please give me a big thumbs up and share this video with your near and dear ones to put them also on the positive side of their health. If you are new here, please consider subscribing to DocLogs. Hit that bell icon to get instant notifications of my new videos. Friends, if you have back pain or neck pain, please share your thoughts in the comment section below. If your back pain is chronic and debilitating, friends, you may be having spinal canal stenosis. Let's discuss. I'll be back with another interesting DocLog very soon. Till then, feel awesome, live awesome, and take good care of your health.